bypass patients, we perform the operation as defined before by with two techniques. These two techniques is one classic roux and Y gastric bypass and the other mini gastric bypass. In roux and Y gastric bypass, we perform a very little stomach portion at the upside of the stomach, and we make a small bowel anastomosis there. No stomach resection is performed in bypass operations. And in mini gastric bypass, we perform a little stomach shaped like sleeve, and we make an anastomosis with small bowel to that sleeve part. And the difference between them are maybe a little bit, some reflux disease may occur more in mini gastric bypass. And in sleeve, we resect the stomach, partially we resect the stomach by vertically, and there is no bowel attachment in sleeve. The difference between them, for example, in gastric bypass patients, generally the patients have maybe vitamin losses and deficiencies and mineral deficiencies, and they may have abdominal pain, sometimes cramps, and sometimes diarrhea, and sometimes there's a syndrome called dumping. They may have dumping syndrome. In sleeve patients, most of these factors do not occur because you do not attach and you do not convert the small bowel, small intestine. For that reason, the sleeve operation is more physiologic operation, and if we perform sleeve operation to a patient that young and have not too much diabetic disease, he will have or she will have a very healthy future and life. But if we perform bypass, they may have some problems like that. But in patients who have too much diabetic status, too much diabetic problem, and if they are sweet eaters, they eat too much, the bypass is more available to them. But generally, sleeve is a more physiologic operation and more confident and safe operation.